So this is going to be the foam roll technique we're going to use for the quadriceps. That's the big muscle on the front of the thighs. So I'm going to set up the foam roller first of all perpendicular to the line of my body. Okay, so the foam roll is going across and I'm going to lie straight down along my workout mat, placing my hands in front of the foam roll and the opposite knee that I'm not working on above the roller. I'm going to bring this knee up and lower myself down onto one elbow, resting on the opposite knee that's over this side, and then resting the belly of the muscle, what's called the belly of the muscle, the main part of the muscle, as much of that muscle tissue on top of the foam roller as I can. Now you can let the foot relax onto the floor as I'm doing here, or you can let the foot hover off of the floor. And as soon as you start to lean your weight into that thigh, it's going to feel pretty tender already. Now, we don't need to make big movements with the foam roll. We're not looking to go at this aggressively or move fast and try and sort of steamroller the muscle, but just get used to that discomfort and that pressure. To begin with, it's going to feel mostly discomfort rather than any release. That really comes after you finish the application and you stand up afterwards and you begin moving around. So in terms of movement, maybe focus on about an inch of movement at a time, so nice and slow. That way you're not going to cause any real discomfort or any bruising or anything like that. It should be something that you get from spending time doing foam rolling, is bruising of the muscle. But the way to avoid that is to go slowly, go at an intensity, a level that is right for you. You can position yourself such that you can take weight off of the roller, kind of pull that punch, and I'm doing that by, as I say, resting my elbow, the opposite hand, and then the opposite knee. So I've got 3 points of contact plus the muscle resting on the roller. And I'm still relatively just focusing on the mid-thigh. Now I'm at a slight angle, so you can see from the foot that's on the roller, I'm not straight down facing the floor, but I'm at an angle. And the reason for that is that there's this common line of tension at the roughly 45-degree angle of the muscle that gets most of the tension, almost like a fault line, of a stress line. And it's closer to the iliotibial band, the IT band, which is simply a tendon that runs down the outside of the leg and stabilizes the hip and knee. And the muscle tissue closer to that outside edge is where we get a lot of tension build up. So again, still very much in the middle part of the muscle, roughly halfway between the hip and the knee joint, and I'm still on that outside edge. And as I move across, rolling the leg and also rolling up and down across it, I can feel lumps and contours and texture almost of these muscle tissues. I'm not trying to force my body weight down into the roller, I'm just running across and trying not to tense up the leg. So staying as relaxed as I can. Again, sharing my body weight as evenly as I can across my knee, my elbow and my hand. The more I can relax into this, the easier it's going to be, and the more benefit I'm going to get, the better effect I'm going to have from this self-massage technique. So, having worked now on that mid-thigh area, I'm going to change the angle slightly. I'm going to go on to a bit more of the outside edge. For this, you can see I'm coming a bit further around, you'll be able to see a bit more of my back, and I'm bringing this foot, the opposite foot, up, or my knee up, so I'm just on the foot as I roll up and down the outside of the leg. I'm taking it still nice and slow and still relatively central to that mid part of the thigh. Again, on the outside edge, I can feel quite a lot of tension build up from previous workouts, recent workouts that I've done. And whilst at the moment it feels mostly just experiencing that tenderness, I'll notice that some areas are more tender than others. It's not really making it feel like the release right now, that release of tension that comes afterwards. So I'm keeping my breathing nice and consistent, nice and slow, nice and relaxed breathing. And that has the benefit of helping relax my whole body. My sympathetic nervous system is stimulated by that slow, relaxed breathing, and that's the rest and digest part of my nervous system. So I'm getting my muscles to relax even more by regulating and controlling my breathing and making that nice and relaxed. From here I'm going to turn and go to a more face down position. So I might need to readjust my position on the roller, which is fine. And whilst there's often some tender spots on the front part of the thigh, it's not nearly as uncomfortable as that outside edge. Anytime you need to readjust the position of the roller, you can go ahead and do so. Now I can come, because I'm square on, onto both elbows, trying to keep my posture aligned, but again, as relaxed as you can be through the rest of your body that's not on the roller. The more you do this, the more you apply these techniques, and the more you experience that pressure, that self-massage pressure from the roller, the easier it's going to be to tolerate, the more comfortable it will be, and the better you'll feel ultimately after having done this. So nice and slow, and just working to try and explore those points of tension, anywhere that's really quite uncomfortable and tender. Take it slow, but you want to work towards those points. Rather than try and avoid them, you're going to work towards the most tender parts of the muscle. Now you can work lower down towards the knee joint. I'm going to go onto that angle again. So I'm now spending a bit more time focusing on that section just above the knee, not going onto the knee joint itself, never going onto the kneecap or crossing over the knee joint. And again, just going up and down, investigating where that tension is and where that pressure is needed the most. Okay. That's it. Again, quite a few different contours here, and that's really just where the shape of the muscles start to attach to various tendons. But go slowly if you feel the muscle become thicker, that's directly under the pressure. And you'll want to become more intuitive about where you can work and where you need to spend time doing that work to release that muscle tissue. So I'm going to switch it now and work higher towards the hip. And again, going on the outside edge to start. I might need to change the angle slightly so I'm more sideways on. And start to feel the outside of the hip, the thigh bone, the greater trochanter, which is that outside edge of the top of the thigh bone. So I'm sandwiching the muscle between the foam roller and that bone. And again, you'll get to know where some parts where the muscle is thicker and some parts where the muscle is thinner. And just work to your tolerance, to your comfort level or discomfort level, might be a better way of saying it. Up and down, working maybe an inch at a time, taking it nice and slow. Good. All right. Now, when you come off of the foam roller, give yourself a minute to acclimate back to being stood up. Some areas it's a little bit, you might need a little bit more time than others. But just as you're walking around, if you shake the legs out, you may be going to a squat pattern, or if you've been doing some stretches beforehand, just to see how free that muscle feels. That will tend to feel a lot lighter and a lot freer. And if you're going into an exercise routine, then getting down into squats, for example, is going to feel a lot easier, even after a couple of minutes. And that's our foam rolling technique for the quadriceps.